Have you ever looked at a dental tray and think to yourself, now, how in the world am I supposed to remember the name of all these instruments and their purpose? I know I have. Dental instruments can be a little confusing because many of them look similar, but they all have a specific purpose. In today's video, we are breaking down the most important concepts, dental hand instruments. Chapter 34 of the MDA 15th edition book in a way that's easier to remember and understand. Hey DA fam, it's your girl Leela. Who else? Welcome back to
The DA Study Spot, yeah.
We're going to cover instrument design, classifications, the basic setup, hand cutting instruments, restorative instruments, and a few memory tricks that may help you on the DANB General Chairside exam. Let's get into it, but before you do so, be sure to hit that like, subscribe, and notification bell so you are alerted every time I upload new study sessions. Run it! As a dental assistant, we are responsible for preparing the tray and transferring the correct instrument to the dentist when needed. That means you need to know more than just what an instrument looks like.
You should also know its name, its classification, its working end, its purpose, and where it belongs in the sequence of the procedure. Manufacturers often assign instruments a number, also called a catalog or call number. Some instruments, such as Howe pliers, may be referred to by number more often than by name.
So when studying dental instruments, try to remember the name and the number of the ones that are most commonly used.
Every dental hand instrument has three main parts: the handle, the shank, the working end. The handle is the part the operator holds. The shank connects the handle to the working end. The bends and angles in the shank help the instrument reach different areas of the mouth, and the working end is the part that performs the actual function. The working end may have a point, a blade, a nib, a flat surface, or a rounded surface. You hold the handle, the shank connects, and the working end works.
Some instruments are single-ended, meaning they only have one working end, such as our mouth mirror, while some are double-ended, meaning they have two working ends to the instrument. Dental instruments in this chapter are divided into four main classifications.
They are examination instruments, hand cutting instruments, restorative instruments, and accessory instruments and items. Examination instruments help evaluate the mouth. Hand cutting instruments remove or shape tooth structure manually. Restorative instruments place and shape restorative materials, and accessory instruments support the procedure. The tray is also arranged in that general order from left to right: examination first, hand cutting next, restorative instruments after that, and accessories last.
The tray sequence should follow the order in which the instruments are expected to be used.
The basic setup includes three instruments: the mouth mirror, explorer, and cotton forceps, also called cotton pliers. The mirror helps you see, the explorer helps you feel and detect, the cotton forceps help you carry and retrieve small items. The mouth mirror has four major uses: indirect vision, light reflection, retraction, and tissue protection. Indirect vision means seeing an area that is difficult to view directly. Light reflection means directing light into darker areas of the mouth. Retraction means moving the cheek, lip, or tongue away from the working area. And tissue protection means using the mirror to protect soft tissue from accidental injury. The mirror helps you see, shine light, move tissue, and shield tissue. The Explorer has a thin, flexible working end with a sharp point. It is used with tactile sensitivity to help detect calculus, surface irregularities, and areas that may indicate decay. Common Explorer designs include the pigtail, shepherd's hook, and Orban Explorer. The cotton forceps are used to carry, place, and retrieve small items such as cotton products, wedges, matrix bands, small objects, and retraction cord.
The periodontal probe may also be included during an examination. It has calibrated markings and is used to measure the sulcus or periodontal pocket around the tooth. Now, hand cutting instruments manually remove, shape, or smooth tooth structure.
Common examples include excavators, hoes, chisels, hatchets, and gingival margin trimmers. The two common excavators are the spoon excavator and the black spoon excavator. The spoon excavator has a circular or spoon shaped working end and is commonly used to remove soft dentin, debris, or decay from the tooth. The spoon excavator scoops out softened material. Now, the hoe looks similar to a small garden hoe. and it is used to prepare and smooth the walls and floors of a tooth preparation with a push pull motion, while a chisel has a single beveled cutting edge and is used to break down enamel margins, form sharp lines and point angles, and place retention grooves. Then we have the hatchet, which has a cutting edge that is parallel to the long axis of the handle. It may be used to break down tooth structure, remove unsupported enamel, sharpen line and point angles, and smooth cavity walls and floors. Lastly, we have the gingival margin trimmer, which is a modified chisel. It is a curved blade and is used to trim and smooth gingival enamel margins and place bevels along the gingival margin of a preparation.
Restorative instruments are used to carry, place, condense, shape, carve, or smooth restorative materials.
Starting with the amalgam carrier, which is used to carry freshly mixed amalgam to the prepared tooth. Then the condenser, which has a flat working end and is used to pack restorative material into the tooth preparation. It may be smooth or serrated, and it compresses or packs the material. Next instrument is the burnisher, and it has a smooth working end. It is used to smooth restorative materials and help develop final contours. The common burnishers include football, ball, acorn, t-ball, and beaver tail. Then there are the carvers, which have sharp working ends and are used to remove excess material and recreate normal tooth anatomy. Common examples include the discoid cleoid, Hollenbeck, and amalgam knife. The discoid cleoid is useful for carving occlusal anatomy, while the Hollenbeck may be used to remove or contour excess material, especially in interproximal areas. Next, composite placement instruments, which are designed to place composite restorative material without allowing it to stick to the working end. They may be made of Teflon or anodized aluminum. And lastly, the Woodson instrument, also called an FP1, which is double sided. One end has a nib that may be used as a condenser, while the other has a paddle shaped end and is used to carry dental instruments to the prepared tooth.
Accessory instruments support the procedure but may not always be included in the main tray setup.
Examples include flexible mixing spatulas, crown and bridge scissors, amalgam wells, Howe pliers, articulating paper holders, and articulating paper. A flexible mixing spatula may be used to mix materials such as liners, bases, or cements, and crown and bridge scissors may be used to cut dental dam materials, retraction cord, or thin metal crowns. An amalgam well holds mixed amalgam before it is transferred to the amalgam carrier, and Howe pliers, also called 110 pliers, may be used to carry cotton products, remove matrix bands, and place or remove wedges. And last accessory, articulated paper, which is used to check the patient's bite after a restoration, crown, bridge, or denture is placed.
Let's do a quick review.
Question 1. What are the three parts of a hand instrument? The answer: handle, shank, and working end. Question 2. What instrument make up the basic setup? The answer: mouth mirror, explorer, and cotton forceps. Question 3. What instrument removes soft dentin? The answer: the spoon excavator. Question 4. What instrument packs restorative material? The condenser, correct. Question 5. What instrument carries amalgam? You got it, the amalgam carrier. Question 6. What instrument checks the patient's bite? Absolutely, articulating paper. Question 7. What are the four instrument classifications? Exactly, examination, hand cutting, restorative, and accessory.
All right, y'all, that is chapter 34, dental hand instruments. Now, while this video focused on high yield concepts and instruments you need to understand, my ultimate DANB certification study guide goes a little bit deeper. Think of it as organized notes where you can get all this information in one place. You can find the link in the description box below. If this chapter review helped you understand dental hand instruments a little bit easier, my work here is done. Next week's study session, we're breaking out chapter 35, dental handpieces and accessories. So make sure you like, save this video, subscribe, and share with a DA bestie. And I will see you both at the next study session. Bye.
The DA study spot, yeah.